Other quick questions from the audience? Yes, please.
Thank you, Dr. Georgoulis, for your nice presentation. I would like to ask you why after arthroscopic reconstruction, after the first dislocation, do we have recurrence at all? Why? And why is it, according to the statistics you gave us, more in people who are less athletically active? Students are less athletically active than cadets and athletes, but they have higher recurrence rate, although they had reconstruction.
Yeah, it is. At the beginning, I thought also about this, but by the athletes the operator was this Dr. Laren. He was a very good. He is a very good surgeon, and also by the cadets was Dr. Arciero. In the other group, there were many people because it was a multi-center study, something like this, and so also. That some people after a reconstruction, they have also a dislocation. It is very usual because if someone has 90% of his patients had good or excellent results, it's very good. We cannot do all the patients 100%. It is not possible, I think.
Two more quick questions at the microphone, please, and quick answers, please.
Thank you. If I understand well, in some selected patients, you make stabilization after the first dislocation, but when do you perform it? Because when you are just dislocated, you have some hematoma and some kind of difficulty. You have to clean all the joint before perform the surgery. So do you do it 1 week or 2 weeks after the dislocation, or do you perform the surgery 1 month or 1 month and a half after the dislocation, and why?
Yeah, thank you. Generally, 1 month after every injury is better to perform an operation. First, because you are far away from the first injury hit. The second hit from the operation is at least 1 month later. And the second is, it is always better for the surgeon that there is not a swelling in the joint, not only in the shoulder, also in the knee joint. It is better to have better conditions. Also 2 points, for an objective point and subjective point. This is better around 1 month.
Yeah, I agree with you. Sorry.
Just a comment that we know that the redislocation is depending on age, and no matter what kind of operation you do, whether you a Bankart repair, a bony repair, whatever, the younger age they redislocate a lot more, and that's known. That's it. That's a fact. We can't really change it, probably because of their activities and all that.
Yeah, the thing is this a prevention surgery? I mean, is it right to operate on these patients since this is a prevention surgery? Is that right? I mean, yeah. Maybe we have to wait for the second dislocation, and then we're 100% sure that this is an unstable shoulder. So it's a matter of philosophy, just a comment.
I include this philosophy. I say that at first we have to say to the patients that need to be operated, and the patients, they hesitated, and we can say, okay, at least after the second.
Okay, thank you very much. So
a good proposal.
Next talk will be given by my colleague.